Hello doctor. In today's video we are going to see embryology of cardiovascular system. The cardiovascular system is one of the first body systems to appear within the embryo. It is active by the beginning of the 4th week, when the placenta is unable to meet the requirements of the growing embryo. In the embryo, formation of the heart begins in the pharyngeal, or throat, region. The heart derives from embryonic, mesodermal germ layer cells. The development of the heart begins with the formation of the primitive heart tube following the folding of the embryo during the end of the 3rd week. From superior to inferior, the primitive heart tube is comprised of 6 regions: aortic roots, arterial poles, truncus arteriosus, bulbus cordis, ventricle, atrium, sinus venosus, venous poles. The heart tube continues to elongate and begins looping at around day 23 of development. The bulbus cordis moves ventrally, caudally, and to the right, forward, down and right, and the caudal portion, the primitive ventricle, moves dorsally, cranially and to the left, backwards, up and left. This process produces a shape that is much closer to the fully developed heart, atria. At the 4th week, the sinus venosus is responsible for the inflow of blood to the primitive heart, and empties into the primitive atrium. It receives venous blood from the right and left sinus horns. Aortic arches. The early arterial system begins as a bilaterally symmetrical system of arched vessels, which then undergo extensive remodeling to create the major arteries that exit the heart. The derivatives of the aortic arches. First arch contributes to the maxillary, hyoid and stapedial arteries. Second arch contributes to the maxillary, hyoid and stapedial arteries. Third arch forms the common carotid artery and part of the proximal internal carotid artery. Fourth arch, right arch, forms the right subclavian artery. Left arch forms part of the arch of the aorta. Fifth arch either never forms, or forms incompletely and regresses. Sixth arch, right arch, forms the right pulmonary artery. Left arch forms the left pulmonary artery and the ductus arteriosus. Each of the arches has a corresponding nerve during development. The most important of these is the recurrent laryngeal nerve, a branch from CN10, which is associated with the 6th arch. Right recurrent laryngeal nerve initially hooks around the right 6th aortic arch. However, when the distal part of the right 6th arch disappears, it moves up to hook around the right subclavian artery, 4th arch. Left recurrent laryngeal nerve hooks around the left 6th aortic arch. The distal part of the left 6th aortic arch persists as the ductus arteriosum, and so the nerve remains in this position. Cardinal veins. Right common cardinal vein and right anterior cardinal vein gives rise to superior vena cava. Right supracardinal vein, right subcardinal vein, right posterior cardinal vein gives rise to inferior vena cava. Right supracardinal vein gives rise to azygous vein. Left supracardinal vein gives rise to hemizygous vein. Right and left white line veins and anastomoses between them gives rise to superior mesenteric vein, inferior mesenteric vein, splenic vein, portal vein, hepatic vein. Heart septa. The septation of the primitive atrium involves the formation of 2 septa and 3 holes. The major cardiac septa is formed between 5 to 7 weeks of development. Aortic pulmonary septum is formed from the neural crest and extends to separate the aorta and pulmonary trunk. Interarterial septum development. The interatrial septum is the wall of tissue that separates the right and left atria of the heart. The interatrial septum forms during the 1st and 2nd months of fetal development. The first is the development of the septum primum, a crescent-shaped piece of tissue forming the initial divider between the right and left atria. Because of its crescent shape, the septum primum does not fully occlude the space between the left and right atria. The opening that remains is called the ostium primum. As the septum primum grows, the ostium primum progressively narrows. Before the ostium primum is completely occluded, a second opening called the ostium secundum begins to form in the septum primum. To the right of the septum primum, the septum secundum begins to form. As the septum secundum grows, it leaves a small opening called the foramen ovale. The ostium secundum progressively enlarges and the size of the septum primum diminishes. The septum primum is nothing more than a small flap that covers the foramen ovale on its left side. This flap of tissue is called the valve of the foramen ovale. It opens and closes in response to pressure gradients between the left and right atria. When the pressure is greater in the right atrium, the valve opens. When the pressure is greater in the left atrium, the valve closes. Because the lungs are non-functional in fetal life, pressure in the pulmonary circulation is greater than that of the systemic circulation. At birth, There is a reversal in the pressure gradient between the atria, resulting in functional closure of the valve of the foramen ovale. Permanent anatomical closure of the foramen ovale occurs with time in normal infants. Inappropriate closure of the foramen ovale results in patent foramen ovale. Fetal postnatal derivatives, left umbilical vein ligamentum teres, contained in falciform ligament. Right and left umbilical arteries medial umbilical ligaments. Ductus arteriosus ligamentum arteriosum. Ductus venosus ligamentum venosum. Foramen ovale fossa ovale. Allantois/uricus median umbilical ligament. Notochord nucleus pulposus of intervertebral disc.